As far as the history on my shoulder, it had been degrading for quite some time. In days gone by, I injured it originally in sports and just living life, shall we say, and put off doing anything about it for not having a good understanding of what my options were. And finally, the pain got so bad, I sought out Dr. Kruse, learned that I had options, pursued those options, had a total shoulder replacement done, and from day one, the minute I woke up from surgery, I knew it was a different world. And if when I got home from the hospital, if he knew how much I used it against what the guidelines were, uh, it just was, it was working perfectly. And here it is a year later today, and I've got total use of the arm, total movement, and pretty much unrestricted ability to do what I see fit.
Perfect. Now show me, let's see your motion. And by the way, this is a reverse shoulder, So just take your hand out. I want to lift all the way up as high as you can go. Okay, hand behind your head. Let's see here, perfect. And then go behind your back for me as well, which you're able to get very nicely behind your back. And so you've got a beautiful arc of motion, minimal pain. I think you're going to have a great shoulder. It's been a pleasure to take care of. And
Looking forward to future opportunities to do business with you.
sounds good. All right, thanks, Marshall.